All right, Dr. Colleen Fogarty joining us now from URMC with some very important information about testing. Good morning. Thank you so much for joining us. Of course, we're doing this through video for obvious reasons. Good morning.
Good morning, Leah.
First of all, let's tell folks at home who can be tested for COVID-19. What are the qualifications?
Sure. Well, anybody who's having symptoms, of course, would want to be tested. And we need to understand that testing doesn't actually change the course of treatment or the illness. So people with mild or moderate symptoms really do not need to be tested for the COVID virus. As we talked about earlier in the week, if people are having symptoms, you should call your healthcare team or call the information hotline about what to do. Don't just show up in the office for risk of infecting other people. Most people are going to have a very mild case, and they're going to be fine doing home care for the 2 weeks with curing themselves on their own. There's no medication that will take away COVID or cure that infection currently.
Are we still looking at the 80 to 85% of patients will recover on their own at home without the need for hospitalization?
Definitely. That's correct.
The high-risk group, the elderly, correct? And who else is at high risk for complications?
So people who have certain kinds of health conditions, perhaps heart disease, diabetes, lung disease, HIV, or other conditions that lead to immune compromise, and asthma, all of these people may be in a higher risk category. And those people should be calling their healthcare team and would likely be tested for the COVID virus if they were having symptoms.
Okay. You know, a lot of people are panicking right now, and I think the key is providing facts so that we can get a handle on this and fight it. What do you want to say to folks watching who are anxious?
Yes, anxiety and fear is really prevalent right now. The most important thing people can do right now is social distancing. Please stay in your home. Even if a young person feels that they're not particularly at risk, this is what we can do as a community to protect our elderly neighbors and friends and to protect who are more medically at risk. Is we can stay in our homes, we can practice excellent hand washing before eating, after touching any surfaces, caring for ourselves and our family in the space of our home.
Because the message is we will get through this, we just have to take the steps necessary to prevent the spread.
Right, and if we transmit, as a community, transmit less infection, then there will be fewer people who need testing and health care and more people who will stay healthy. So we really need to work on that message of staying in our homes and caring for one another in the home.
All right, Dr. Fogarty, thank you so much. Some very important information this morning. We appreciate you joining us.
Thank you.
If you missed any of this interview, of course, we're going to post it along with everything else on RochesterFirst.com.